Hi, I'm Andrea and I'll be showing you how to take a bitewing x-ray. So for the bitewing x-ray, we have Dexter set up here. Remember, with all of your patients, you want to make sure that they have the lead apron on. And with the bitewing, the purpose of this is to be able to check in between for cavities. So when a patient comes in, if they have early decay starting, we cannot visually see it. We cannot feel with an instrument for it. So the bitewing will show us if the patient has beginning decay or any other decay in there. So this is a digital sensor. When taking the x-ray, you always want to be sure that the cord is coming out of the mouth. So it should never be going back, always coming straight out of the mouth. For the bitewing x-ray, it's going to capture the upper and lower teeth in occlusion, meaning they're biting together. So this image will not show any roots, it just shows the crowns of the teeth, and our goal is to get pictures of those contact areas. So when placing the sensor, remember, cord comes out, the white side or the flat side of the sensor will always face towards the PID, or the position indicating device. So you never want to take a picture of the back of the sensor. It won't produce an image. So we always want to make sure the flat side or the side with the logo on it is always facing the PID. For placement, we'll go ahead and open our Dexter. When we take bitewings, we take 4 images. We're going to take a molar shot, a premolar shot on both the right and the left side. So right now I'm going to set this up for a molar shot. You'll have your patient open, have the sensor flat, and then rotate it into place right behind those molars. When I'm placing for the molar shot, I want to be sure that the end of the sensor is behind that last tooth. When I'm lining up my PID, the one thing about human anatomy is we can use landmarks to help us. So the outer corner of the eye will open up between the first and the second molar. And when we're doing the premolar image, we can use the iris as a guide, and just kind of straight down is where we would open up between 4 and 5. Since we're doing the molar image, we're going to go ahead and focus on the outer corner of the eye. And a lot of the x-rays, when we're taking it, it's based on geometry and angles. So you'll hear me say parallel, which is 2 lines that never intersect, or perpendicular, where it comes to a T. So we want to line up our PID perpendicularly to the sensor, and we want to pretend there is a beam coming out of the center of the PID. So my imaginary line, I'm going to use the outer corner of the eye, come down, shoot my imaginary beam between 2 and 3. You want your PID to be close to the face, but not lying on the face. So I'll line this up. The end of the PID is parallel to the sensor. And so now I'm ready to take my shot. So I'll push the exposure button and capture the image. X-ray. Okay, I don't know why it didn't work.